Thanks, Jonathan. And I shout out to you too, because as you know, I got interested in ozone therapy when my dog Chaz had cancer, and I had tried everything from tumor vaccines, genetic testing. He was on herbs and even mistletoe injections. I went the whole gamut. And ozone is something I'd heard about at the AHVMA, but hadn't really heard about it. So when I contacted O3 Vets, they were able to get me a unit right away. And it really meant a lot to me so that I could give it a shot with him. So I'm kind of new. I'm probably one of the newer people using ozone therapy, but I think that's maybe contributed to my enthusiasm and curiosity, like what else can I do with this amazing tool? And it really has been amazing. So I wanted to start this lecture by first a disclaimer. So there are very few contraindications to using ozone therapy. One of them is for acute hemolytic anemia in people. This is a genetic condition that can be exacerbated with ozone therapy potentially. But at the very end of this presentation, I'll show a slide where they were looking for this problem in dogs, and apparently it's not an issue for dogs. Not to say that I would necessarily jump right on ozone if one of my two patients that I'm going to talk about, if they showed up in the very, very acute phases, I'm always going to start. I believe in integrative medicine too. I'm going to start them on steroids. But anyway, that caveat out of the way, I didn't want people to be thinking about that through the whole lecture and not taking in like what we've seen, the benefit with using ozone. So with that caveat, let's get started. Oh, and I love this slide. To me, it looks like a little red blood cell trying to run the gamut of complement and antigen, trying to slash it in the blood vessels. So ozone to the rescue. So a little bit of science, a little bit of background. I know that we've got a mixed group of folks, veterinarians and pet owners, people that are curious. So I want to give a little bit of background about why this is a problem and some clues along the way as to why ozone might help. So immune mediated hemolytic anemia is one of the autoimmune diseases that we see in cats and dogs. And in this case, the host, the body, is making antibodies against its own red cells. And that causes them to look like foreign material, and the body will attack them, leading to anemia. So there's different types. Primary is the most common form. We don't know what the direct cause is in most of these cases, but because 90% are in purebred dogs like cockers, Springer Spaniels, and Poodles, there's probably some predisposition in that way. Secondary is where the immune reaction is triggered by something truly outside the body that we can identify, like infections, babesia, commonly from flea infestations in kitties, mycoplasma, different medications like sulfa antibiotics, and even thyroid medication, methimazole. There are some retrospective studies that have shown within recent vaccine episodes that there can be a change, a shift in the immune system. I mean, that is what vaccines are doing, is stimulating the immune system. And if it gets overdone, then that can trigger this autoimmune condition too. Snake bites can also do that. Recluse spider bites also, and cancer, as we know, is going to cause a lot of changes in the body and creates a lot of inflammation, and that will also sometimes trigger the body to go after the red cells. There's two places where the body will attack the red cells. Intravascular is just like that very first kind of cartoon slide, where the antibodies on the surface of the red cell attract complement, which is a big protein, and then the antibodies and the complement together tear away at the outside of the red cell, and it bursts. So a lot of these dogs will be jaundiced, so yellow sclera, their skin can be yellow, especially in the kitties. It's easy to see it in their ears. The other one is extravascular, so outside the bloodstream, where the antibodies or the autoantibodies on the surface of those red cells attract the attention of especially the liver and the spleen. So in some extreme cases, and we'll go through, what the conventional side can be, we actually take the spleen out in some of these where you just cannot get the immune system to slow down and stop attacking. And it can be life-saving, but that is, now we've lost our spleen, which is the main organ of filtration. It also provides a lot of immune oversight. People that have to have splenectomies have to have multiple vaccines on a regular basis to try and protect their immune system, or they have to do other things, to guard against outside invaders, because that's a big job of the spleen. So if at all possible, obviously we want to save that. And ozone, I believe, is a tool for that. So what are the clinical signs? Here's a gum tissue of a dog. You can see how pale that tongue is. But if you look at the gum line, you can also see that it's yellow. So that would be when the blood cells are bursting in the bloodstream, it's releasing that bilirubin pigment, that hemoglobin, and it's going to change the color of not just the gums, but it will filter through the kidneys and cause a dark, almost bloody looking urine that looks like port wine. They call it port wine urine. If you're running low on red cells, you're running low on oxygen. So that's going to make these dogs and cats very lethargic. They just don't have the energy. They might go, a lot of times that's what people will say. They just don't have as much energy. You do your exam, you lift the lip, and you're shocked, to see how pale they are. If it's the liver and the spleen, the extravascular, then those organs are going to get enlarged because they are engorged with these red cells. There's a lot of inflammation going on. So the belly, especially the front half, is going to feel more distended and full. Because the oxygen's low, you're going to have tachycardia, so a faster heart rate. They're going to breathe faster because they're oxygen starved. And a lot of times there's a fever, especially if there's an infectious agent at work or cancer. Different ways to diagnose it. One of the easiest ways that we call bedside would be to take a drop of blood and a few drops of saline. And you can see it's called stippling, where the blood cells are starting to clump together. That's because they are agglutinating. And that doesn't normally happen when you mix this with saline in a normal dog. There's a specific test called a Coombs test that can help in the diagnosis, but not always accurate. The cells will change their shape and become spherocytes. Ghost cells are more common with immune-mediated disease. Also, hemoglobin in the urine and free hemoglobin in the blood, and high bilirubin in the blood as well, all byproducts of these cells bursting or being destroyed in the liver and the spleen. Threw this in here, it's very complicated, but it's a nice algorithm by the American Academy of Veterinary Internal Medicine, consensus statement to try and determine if you actually have an immune-mediated cause of anemia or if it's something else. So just threw this in for a good reference slide. And then how do we treat this? So before I knew about ozone, there are a number of conventional medications. That's the first line of defense. Prednisolone or prednisone, used at higher doses to suppress the immune system. But of course, many of you know from personal experience or for treating pets that you've got a lot of side effects. So they gain weight. There can be damage to the kidneys. When we suppress the immune system to save those red cells, we're also making the body susceptible to secondary infections. So I have one of the cases I'll show later will demonstrate that. You've got elevated liver enzymes because of the inflammation in the liver as a side effect of the prednisone chronically. Cyclosporin, if the pred doesn't cut it, then often we have to add a second medication. And both of these cases I'm going to talk about had come to the point where prednisone was not working well enough, and their internist had to resort to adding cyclosporin to try to save their lives. And and so it can be very effective at maintaining a normal red cell count, but it's got even worse side effects than the prednisone, which is why it's not your first line of defense, but second. They often don't eat. They can have a lot of nausea and vomiting, diarrhea. In dogs, the gums can become hyperplastic, overgrown and lumpy. Worse hepatotoxicity, and an increased risk of secondary infections also because we're suppressing the immune system. And then an increased risk of pulmonary thromboembolism, which will be clots in the lungs, which interestingly enough is one of the main causes of death in dogs that have this immune mediated problem in the first place. So you're already at risk for those clots, and now we're adding a drug that can also increase the risk potentially. So that's between a rock and a hard place for sure. Additional therapies besides medications like this would be stronger, almost chemo. Some of these are chemo drugs to suppress the immune system. Plavix to try and prevent those clots in the lung that I was just talking about. In some cases, especially when you first diagnose these animals, they may be so anemic that it's not compatible with life. And the only thing you can do to bring them back from that brink is a blood transfusion. But there's some potential, especially not so much with the first transfusion, but additional transfusions. The immune system's already on the lookout, already hypervigilant against those foreign cells, and now we're giving them actual foreign cells. So it can, in some cases, accelerate that immune overreactivity. There have been some papers talking about using human immunoglobulin, but again, it's a non-animal substance, so there's the potential for that to also keep that immune system hyper engaged. Splenectomy, as we talked about, remove the organ that's scavenging these cells and taking them out of circulation. There was a very interesting treatment that was happening first at UC Davis in California, where they were taking some of these patients, some of these dogs, and almost like doggy dialysis. So they were running their blood through a machine and cleaning it, so to speak. The plasmapheresis seemed like an awesome therapy, extremely expensive, and not widely available. So there's obvious limitations with that for most people. But then a recent paper came out suggesting that it's not actually that much better when they did a retrospective study versus other modalities. Some anecdotal evidence of melatonin may be helping too, especially on the human side. So hopefully there will be some more information with pets. And then in my hands over this last year, definitely ozone. So I'm excited to share how that can help. But before we do that, just a little bit of information about if all you have are conventional tools that I just went through on that whole list, you have up to 70% fatality rate in dogs, usually around 50%. If they're not responsive to therapy, of course, it's the high end. If they get that PTE or that pulmonary thromboembolism, blood clots in the lungs, side effects of the treatment, the different drugs, the mortality rate's going to go up more. Cats, surprisingly, even though their immune system loves to get inflamed, they live on inflammation, but they fare better. But there's still almost 25% of those kitties are not going to make it. So these are published studies that are listed below talking about those statistics. So then how can we use ozone, specifically systemically, to improve our treatment of immune-mediated hemolytic anemia? So we know that ozone therapy increases ATP function in the mitochondria. The mitochondria are everything, for the health of the body. Every single cell is packed with mitochondria if it's healthy. So this increased ATP production in the red cells improves their function, especially those that are still left in circulation because they're already working at um, under stress because there's not as many of them. So to try and deliver the function that's needed throughout the body, every one of those that are still left, we need to boost them as best we can. And one of the ways that that happens is that ozone has been shown to increase the release of oxygen. So once those red cells pick up oxygen in the lungs and they're back in circulation, this this enzyme called DGP actually allows the hemoglobin to release even more oxygen into the bloodstream. So it's increasing that delivery system um, because ozone can actually directly affect that DGP. Not to mention that when we're giving ozone, one of the breakdown products is oxygen. So we're oxygenating the blood as well when we're giving a systemic therapy. So ozone therapy also helps to restore homeostasis in immunocompetent cells. So the cells that are supposed to be running the show for our immune system, it brings them back into balance. So if the immune system is overactive, like like we're talking about with immune-mediated hemolytic anemia or rheumatoid arthritis or even MS, ozone can downregulate those inflammatory cytokines. They're kind of like little messengers. They deliver messages on the surface of the white cells, and it can restore the normal function. So it brings it back down into normal function. Whereas the opposite happens with like a cancer patient. So if the immune system is downregulated, the ozone actually helps improve the immune system's response in that way. So it brings back homeostasis or back into balance. We also know that ozone therapy stimulates a tremendous amount of antioxidants. So when ozone is introduced into the body, it's kind of like going to the gym and working out. When you get when you get started with a good workout plan, the next day it can be very uncomfortable. You have a little bit of sore muscles, but if you stick with it, that stress on the muscle groups actually promotes more and more strength and a buildup of muscle tissue. Well, the same thing is happening when we use ozone. So this stress on the oxidative system creates hormesis, or it's called hormesis. I heard another person talk about it as toning. So just like you think about toning in the gym for the external body, it's toning on the inside for the use of oxidants or antioxidants. So it's triggering the body's um, immune system to produce these antioxidants, which we know are so beneficial for inflammatory diseases. One of the best known ones is glutathione. It's essential for the function of the mitochondria and so many other conditions in the body. So when we upregulate those, we actually get a decrease in chronic inflammation. And autoimmune diseases are one of the conditions that have an overload of inflammation. So that's a big benefit there. Ozone therapy has been shown to provide even better antioxidant effect than vitamin C. So that gives you some idea how powerful that can be. So what I'm going to talk about, there's lots of ways to administer ozone, but in particular, we need this to get into the body systemically. The most effective way that I've seen is to use the major autohemotherapy, where we draw blood from the dog or the cat, we mix it with ozone very gently, add some saline, and it's run from the ozone generator through a pump down to a UV light box, UVB. O3's equipment is called a chimp. So as that goes through, it's spiraling through a little glass tube called a cuvette. So it's exposing those cells very slowly and consistently to UV light, which is also modulating the immune system. So that's exactly what we're going for with an autoimmune disease condition like this. The minor autohemotherapy has been described as a vaccine of sorts that helps when we draw patients' blood and mix it with ozone in this form. We're not being gentle with those red cells. We shake them up, percuss them, they break those little red cells, and it releases whatever's triggering this autoimmune condition, if it's a toxin, if it's a bacteria, a fungus, if there are any cancer cells in that particular blood volume, then all that is going to be instantly neutralized and killed with the ozone. So now you're giving, which is how the earliest use of vaccines were actually mashed up pieces of dead tissue injected back into the body to trigger a response from the immune system. So if we can show the body what it's actually working against, then it can take the focus off the red cells and actually focus on what's triggering it. The third part is the rectal insufflation, where when we give doses of ozone gas into the very end of the GI tract into the rectum, we get a big boost in ozone and oxygenation to the liver in particular. And as we've seen, a lot of these drugs that we're using cause liver inflammation and high enzymes. And some of the triggers for the immune problems can also cause a lot of tax on the liver too. So here is an image in the top corner is what that UV light box looks like. There's actually 3 bulbs in there to give a full spectrum of UV. That's the chimp, and the cuvette is laying there in the trough. So we collect heparinized blood. I like to use like for if I'm really trying to stimulate the body, I'll use up to 4 mLs of blood per 10 pounds of body weight. If they're anemic coming to me, obviously I'm not going to take that much. I wouldn't feel comfortable, probably 1 ml per 10 pounds, maybe 2. Um, I don't like to draw from the jug if it's an autoimmune condition, just because I don't want any hematomas here. If I'm going to draw, especially if the immune system's already also targeting the platelets, then you definitely want from a limb. And that way you can put a good bandage on it and make sure you don't have a hematoma there, where we obviously can't bandage the neck. So then you would inject your heparinized blood into a collection bag. We hold it kind of flat so that there's no turbulence. And mix the ozone gas with it, usually to 30 to 50 micrograms. If I'm using, let's say, 2 mLs of blood, then I'm going to have 4 mLs of the ozone gas at 30 to 50. And then I'm going to add double again the amount of saline, and we rock that very carefully to mix the ozone and the saline with the blood sample. Then we run the cuvette through the UV chamber for about 20 minutes. And then we're going to collect the blood again in a syringe and give it through an IV catheter. In that bottom slide, you might be able to pick out that there's a filter there. Super, super important in this case in particular, because of the risk of those blood clots in the lungs. We cannot take a chance in these patients, especially, that could happen. So we always use a filter in all of our MAHT procedures, but especially in this case, if you're not already doing it, this is mission critical to do that. And we give it slowly. We give it over about 10 minutes time. Here's an example of a minor. So we usually draw just a cc of blood, or sometimes if I'm doing a major, I'll take a little bit of that sample and mix it with ozone gas straight, and then really percuss it, really bang it against the heel of the hand to break those cells up. In this case, because it's going intramuscular, I don't use the higher concentrations of gas. It stings. So I'm usually going to do 15 to 20 micrograms, and that seems to be very comfortable. And then we're reintroducing the non-viable pathogens and proteins to stimulate a balanced immune response to, like I said, to any pathogens that might have triggered this problem in the first place. And we're going to go in the epaxial muscles, like you would give if you were using a heartworm treatment, something like that. We want those nice big muscle bellies, and then we don't have to worry about causing any damage to the sciatic nerve in the thigh. It's just a better place to inject, in my opinion. And I like this slide to try and help people understand, like, how if you put gas in their butt, how does it actually help? But you can see from this diagram of, the anatomy of the blood of the vascular system that the GI tract, the colon in particular, is really rich with blood supply that goes straight to the portal vein. So 1 ml of ozone gas at about 35 micrograms we use per pound of body weight. So that's our calculation. We give it slowly. If you give it fast, of course, you're going to get a big dilation in that rectum, which can be uncomfortable. It can make them feel like they have to poop right away, and you don't get necessarily the full benefit. Uh, so we're delivering it to this rich vascular system. Uh, Sometimes I'll tell clients too, people are sometimes familiar with suppository medications like compazine. We've used phenobarb in the rectum in days past to try and stop seizures, and this is why, because it has a first pass through the liver. You also get the benefit of improving liver function. So any liver case, I'm going to do a rectal insufflation also, but in this case, helping to bring down inflammation in the liver due, secondary to medications or the condition itself. All right, this is my favorite part. I always like the case study. So the first one I'm going to tell you about is a kitty named Mittens. She We had not seen her before. Her mom was calling around trying to see if anybody had blood for this cat. It had been at the ER, and they diagnosed her uh, with the severe anemia. She was down to 11%. So for folks that are not veterinarians, that's about a third of what she should have had. She was in really bad shape, and she definitely needed a blood transfusion. Usually, anything under, you know, 18 to 20% is going to need that, and it can be life threatening without it. So she went to um, a specialty hospital, and they saved her life by giving her a blood transfusion. She had weirdo blood anyway, so a regular blood transfusion may not have worked for her. So they cross-matched, did all the things right, started her on prednisone, got her stabilized, added doxycycline just in case it was mycoplasma, and eventually had to resort to adding cyclosporin. I think she was under their care for about 6 months and never stabilized enough to start taking her off the meds. And she was on very high levels of steroid and cyclosporin. I was surprised she was able to get the kitty to take it, but by the time she came to us, I wish I had thought to take a video of what she looked like, but she couldn't even lift her head up. She was like a little pancake kitty, just sternal, with her head down, extremely weak, extremely lethargic. Mom came for a quality of life appointment. She thought she had cancer, and she was afraid, that this was the end for her. And this was my first time trying ozone. I said, "Well, do you want to try?" She's so young. They think it was autoimmune, but she's just so sick. So I stopped the cyclosporin immediately, and she went for ozone. So we started a weekly course of using the major autohemotherapy through the UV light and the rectal. And after 1 week, she was already eating again. Um, she could be sternal. She still wasn't standing up for us anyway. She started to purr. After the second treatment, she's standing up, walking around, talking to us. On the third out of four, she's doing that kitty head, butt, and roll and talking to us, just so happy. Her mom is absolutely thrilled. By the fourth one, she's like a kitty, like a kitten, just zoomies through the house. And it's taken several months because I don't want to um, let her immune system sneak back in here. So we did a month's worth of ozone on a weekly basis. Her liver enzymes came back down to normal, and we have been able to wean her off not just the cyclosporin, which we started right away, but off the pred as well. So she's done very well. Second one is Millie. Millie actually started with a different autoimmune disease in her gut, protein-losing enteropathy. I do have 2 other cases that we've treated with ozone for the immune hemolytic anemia, but this one has some extra neat things that I wanted to share this case, especially. So still an autoimmune disease, but it was targeting her GI tract to the point that she was leaking so much from her gut that the protein in her blood was actually leaking into her bowel. So she has protein-losing enteropathy, secondary, very high levels of liver enzymes because of the steroids and the cyclosporin that she was on. The steroids were making her so hungry that she was eating poop, and because her immune system was suppressed, she developed this little tumor between her toes, and never did get a diagnosis. I don't think they actually biopsied it at the specialist, but probably because of chewing on the toes with her poopy mouth, she developed abscesses up from the carpus to the elbow on that same leg. And they cultured them, did a culture sensitivity. There were no antibiotics that would touch it, and the owner was told that there was nothing else that could be done. She had heard that we offered ozone therapy by a friend of hers, so she decided to bring Millie in. And I had never seen anything like those abscesses either, but we decided to give it a try. So again, just like with Mittens, discontinued the cyclosporin right away. And I did not start tapering the pred as aggressively as I did with the kitty cat, but we did start to wean her off of that too, because we have these abscesses. We've got the immune system on our side to try to get this under control. Meanwhile, the underlying problem is this leaky gut. So I did have them change her to a cooked diet, gently cooked diet. And then we started to address this mass and these abscesses using ozone. So went through each one of these little pockets and lanced them with an 11 blade, and then used a catheter, like a Tomcat catheter, to flush each pocket with ozonated saline. And got a really nasty gelatinous material out of each one. We did that once a week for 3 to 4 weeks. And as you can see on the bottom slide, after a month, there's hair still growing that needs to grow back, but all of those abscesses were gone. Mom was just thrilled because she would not stop licking them. This whole leg had to be bandaged. It was a real pain in the rear to try and keep these lesions protected. We did a major autohemotherapy for her because of her autoimmune condition, because of the cancerous mass and these drug-resistant abscesses. I also did a minor hemotherapy around the interdigital mass. So I would rub a prilocaine cream there to numb the skin, and then inject about a cc, maybe a little less, interdigitally there. And the mass disappeared also within a month. So, and like I said, we changed her to a cooked diet. I did add hepatic support because of her very high liver enzymes, but liver returned to normal. Her albumin returned to normal despite stopping the cyclosporin and the pred. And Mom was absolutely thrilled. We love seeing Millie. So just a couple of references: ozone and medicine, the low dose ozone concept and its basic biochemical mechanisms in action in chronic inflammatory diseases. That had a lot of great information. If you're somebody new to ozone and just want to get a good background on how it can help with all kinds of inflammatory conditions, not just autoimmune, this is a great paper. From that paper is a diagram kind of showing how ozone, when it makes these lipid peroxidases, can stimulate the oxygen release with that DGP, but also improve the immunomodulation and then cellular redox as well. And then, as promised, here's that last paper. So they looked at over 3,000 dogs, and they found one dog with a mild deficiency in G6PD, which is the enzyme that is the problem in people with acute hemolytic anemia. So proof of why I think it's safe to go ahead and use this for dogs and cats. And that's the end of this presentation. So if you have questions now.
Thank you so much.
You're welcome.
Yeah, and you did this all while at a conference yourself and on break, right?
Right.
So great job. You want to stop
Thanks.
share of your screen maybe real quick, and we got a couple questions. We'll get to you real
Sure.
fast if you have a second still.
Yeah, sure do.
Okay. So first question is, in your understanding, in particular, maybe as it relates to this, how do you believe the ultraviolet part of it helps?
Well, as it's been explained to me by you and at some of the other conferences, the UV light is causing that hormesis with the immune system cells themselves. So basically bringing back that homeostasis, and also, I believe, improving stem cells, if I remember that right. Mm. So that's why I think it can help in other like repair situations. But that, again, I'm kind of new to this. Like Dr. Akeem or somebody like that would be awesome probably to answer that very thoroughly.
Yeah, good. We'll move, we just have a couple minutes here, so we'll move on. Our blood samples start to change to a darker color around 8 minutes into the treatment. Does that indicate damage to the sample, or is that common?
I'm assuming you're talking about the major autohemotherapy?
I would assume so, because probably the O3 UV, the combination, because typically you wouldn't have it, 8 minutes worth of treatment unless you're doing the ultraviolet part.
Right, yeah. I'm not seeing that. Obviously the blood becomes bright red as soon as you mix the ozone with it. So I'm not sure if it's getting darker, if maybe your pump is not pushing the blood through fast enough, and maybe some of it is getting a little bit too warm and damaging some cells that way. So for example, Dr. Roman showed me an awesome trick of cutting the ends of the cuvette tubing when you're doing a small sample for kitty cats or small dogs. So you can push it through so you don't have that big volume going through the bag. So that's an adaptation so that we don't have, so even with small samples, we can push it through quickly enough.
Yeah.
That would be my guess.
Yeah, because typically, I think you're right. It, generally speaking, doesn't get darker when it's done properly. So we can talk about that, Dr. Roach, if you want to call or something sometime. Carolina asks, what's the fastest or best way to get ozone to the kidneys? Let's have a kidney issue that they're working on.
My thought would be to do, if you are a veterinarian with acupuncture capability or understanding, to inject either just ozone gas right there or sub-Q fluids that have been ozonated. And for sure, depending on how severe the case is, and if you have capability to do the major autohemotherapy, anything that's very sick, I love it. Absolutely love it.